The scariest thing about getting a dental implant that you need to be aware of is that it could hit your nerve, which is the number one precaution that we as dentists and oral surgeons, people who place dental implants, try to take, is trying to stay away from the nerve. The drill in the implant cannot hit the nerve, because if it does, it could cause permanent numbness, permanent damage, maybe even permanent pain or altered sensation in your lips or your gums. Now, the point of this is not to scare you out of getting a dental implant. People get implants all the time and they're totally fine, but it is information that I believe you should know as a patient before you get an implant done. What are the risks of hitting a nerve? Do I have a nerve that's even in range of this implant being placed? What happens if I get an altered sensation? This is just all information that's really good for you to know as a patient before you get an implant done. It's kind of like that old saying, aim, 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 fire, rather than fire and then worry about aiming afterwards. And the way we do this is we take a 3D image of your jaw. We take that 3D image, then we also take another image of your then we also take another image, an iTero scan or some sort of digital scan, and we stitch those together so that your accuracy is beyond 99.9%. Now, when we look at the screen, we can actually see where your nerve is, we can actually see where the implant is going to be, and we can digitally place this implant so that we can stay away from structures that we don't want to hit. For example, we don't want to hit the tooth next to it, we don't want to hit the nerve, we don't want the implant drill or the implant to go into the sinus, and by planning this digitally, we can stay away from all of those things and stay away from the nerve. Now, the distance between the nerve and the bottom of the dental implant, we always have a safety buffer in mind. My safety buffer is 3 to 4 millimeters. Some people say 2 is the minimum distance as a buffer zone between the implant and a nerve, just in case something happens or we make an error in judgment during the surgery. You're covered because you have a buffer zone so that you don't hit the nerve. Another way that we avoid doing this is we use what is called a surgical guide. Now, a surgical guide is a plastic covering that we put over the teeth, and it has a metal tube in it. The metal tube serves to make sure that we don't deviate in our direction so that we don't hit something that we're not expecting. For example, we put the drill in the metal sleeve and there is almost no variance in that sleeve. There's no way that we can take the direction out of our ideal placement of the dental implant. The hours of planning before and the surgical guide and the 3D technology that we have keep you safe as a patient. So if your doctor's not using these, it is okay to ask why they're not using it and also if they could actually use those instruments. Now, everybody does things a little bit differently. Some people don't use a 3D technology. Some people don't have it because it is very expensive and sometimes it's hard to read, sometimes it's hard to use. Now, as a patient, I realize you have absolutely no control over this. You're just the patient. You're not going to be doing this technology. You're not going to be taking these x-rays and planning it yourself. You're the patient. You're paying the doctor for their expertise to keep you safe. So what can you do as a patient to keep yourself safe? Number one is you should be informed of all the risks before the procedure is done. When the doctor or surgeon is sitting down with you, they need to explain what could and could not happen during this procedure. If there's any remote risk that you're going to hit a nerve, the doctor needs to tell you that beforehand. And if there is a remote risk of you hitting a nerve, you need to inform the patient before that happens. Here are 6 very specific questions that I would recommend you talking to your surgeon or your doctor, whoever's placing the implant, before you get started. Number 1 is, how far away is this dental implant from a sinus or a nerve? If you go through a sinus, it is kind of a difficult situation because now you have a hole in the bottom of your sinus that needs to be plugged. A lot of times this isn't the end of the world if the implant or the implant drill goes into the sinus. There's ways that we can recover that, but as a patient, I believe you should be aware of those things before the procedure is even started. How far away are you from the nerve? How far are you away from the other teeth? In general, we want to stay millimeters away from the roots of other teeth and 2, 3, and sometimes even 4 millimeters away from any major nerve. Are you using a surgical guide? If you're not using a surgical guide, it's not the end of the world. Lots of surgeons don't use surgical guides, but in my opinion, as a general dentist, using a surgical guide is the best way to predictably place implants. I wouldn't do it any other way, but that's just my opinion. It's not bad that you don't use one, but just ask them, are you using a surgical guide? Because, well, they actually make the procedure a lot less stressful. The next question, are you going to place a healing abutment, or can you tell me after the procedure is done if you use a healing abutment? Now, healing abutment is basically when we put the implant in there and we have good torque, which means that the implant is placed correctly and everything is nice and tidy in there, we're gonna place a healing abutment over the site. Now, what this means for you as a patient is that you're gonna have a little button on top of the tooth. In an ideal situation, in my opinion, I put that healing abutment on during the procedure because it saves a step, it saves an appointment, and it saves another time of you coming in, getting numb, having sutures, and doing a little bit more finagling with your implant site. The next question is that you should ask them if you have any known risk factors that's gonna cause the implant to fail. Some of these risk factors are like smoking, nicotine use, nighttime grinding. If you have a lot of these risk factors, it's important that you know before you go into the procedure, because if your implant fails, you knew it failed probably because of these known risk factors. Diabetes, uncontrolled diabetes, that is another big risk factor. So talk to your doctor if you personally have any concerns that the surgeon has of your implant failing, because knowing this information beforehand is critical to the success. And let's say you have an implant placed and it doesn't work out. You need to know why it didn't work out, and also what is the refund policy from that surgeon. That's the next question that I would ask is, if I have a dental implant placed, let's say you're paying $2,000, $3,000 to get that placed and it fails, it just doesn't work. What is the refund policy of that surgeon? I've seen oral surgeons that will place an implant, it fails, they will charge the patient to take it out, which is super easy, doesn't cost any money, and it doesn't cost any time, honestly, to take that out once it hasn't healed and it's failed like in the first week or so. And then they bone graft it, charge the patient for that, and then they charge them again to put the implant in again, which is just really risky to do it a second time knowing that it failed the first time. But not everybody does that, so some people's policies are, if I place an implant and I'm gonna charge you for an implant, I'll place it as many times as you're up for doing the procedure. Maybe you have to place it twice. Heaven forbid we have to place it 3 times, but I'm gonna charge you just the one fee because that is right and that's fair. Not everybody does that, but just as a patient, you just need to know beforehand what the policy is on the refund policy of the dental implant. If it fails in like 2 to 3 years, that's on you as the patient. Nobody's gonna refund your money. But if you have a dental implant placed and something goes wrong, or it hurts, or the implant fails, or it swells and your body doesn't take it. So in short, if your implant fails, you need to know what the policy is just in case something happens. I really hope you like watching this video. Stay tuned for more, and if you could do me a huge favor and hit the subscribe button down here, it would help the channel grow tremendously. Somebody must be at the front door because my dog is just going crazy downstairs. So I'll go to tend to that. Thanks for watching. Hit that subscribe button and I'll see you on the next video.